The cause of death was listed as undetermined. The medical examiner disagreed, citing the presence of tracheal compression marks found during the autopsy as a critical indicator of strangulation. 3 forensic indicators pointed to this finding: petechiae on the ocular conjunctiva, hemorrhages in the eyelids, and pronounced ligature marks around the neck. The initial report acknowledged none of these signs, focusing instead on the absence of blunt force trauma or toxicological evidence. Upon closer examination of the deceased's neck area, the medical examiner noted significant soft tissue bruising consistent with a tight constriction device. Microscopic analysis confirmed subconjunctival hemorrhaging and hyoid bone fractures indicative of ligature application force. These findings were corroborated by forensic pathology reports detailing similar patterns observed in cases of manual strangulation. The comprehensive review of evidence led to the conclusive determination that tracheal compression was indeed responsible for the deceased's demise, emphasizing the necessity of a thorough investigation into such subtle but definitive signs. Chapter: Case background. The case under examination occurred in a residential apartment complex located in downtown Seattle on the evening of March 15th. At approximately 9:30 p.m., a neighbor reported to local authorities that there was unusual activity emanating from one of the units. Upon arrival, officers found the door ajar and, upon entering, observed the deceased lying prone on the floor with visible signs of distress, but no immediate apparent cause of death. Emergency responders initiated resuscitation efforts but were unable to revive the individual. The local medical examiner's office was promptly notified, and an autopsy was scheduled for the following day. Initial observations indicated potential trauma or asphyxia, leading investigators to consider multiple scenarios, including accidental strangulation from self-harm or homicide by another party. The absence of forced entry suggested a known assailant or suicide attempt. However, the exact circumstances remained unclear until further forensic analysis revealed specific tracheal compression marks indicative of ligature-induced asphyxiation. This finding prompted a thorough re-examination of both physical evidence and witness statements to clarify the sequence of events leading up to the death. Chapter: Initial findings. Upon arrival at the residence, first responders noted a male body in a supine position on the bedroom floor. The scene was cordoned off to preserve evidence integrity and prevent contamination. No immediate signs of trauma were visible upon initial visual inspection. However, an unusual mark encircled the neck suggested potential ligature involvement. A preliminary medical assessment indicated no spontaneous breathing or pulse present at the time of discovery. The local emergency medical services initiated resuscitation efforts per standard protocols, but did not succeed in restoring vital functions. Observations noted that the deceased's body position and lack of any apparent defensive wounds or struggle marks indicated a non-consensual event, further supporting the hypothesis of foul play. The presence of an unbroken ligature mark encircling the neck without corresponding external injuries suggested compression of the trachea and cervical vessels rather than strangulation. This finding prompted immediate referral to forensic pathology for a detailed examination to determine causality and manner of death, leading to classification as undetermined pending further evidence evaluation. Chapter: Forensic investigation. At the scene, investigators secured a nylon cord with clear signs of abrasion consistent with ligature use. Swabs were taken from both ends for DNA and trace evidence analysis. The deceased exhibited pronounced petechial hemorrhages around the neck, indicating significant vascular compromise during strangulation. Notable were multiple linear impressions along the trachea corresponding to the cord's pattern, consistent with prolonged application force. Absent were defensive wounds or signs of a struggle within the immediate vicinity. Unexpectedly, latent fingerprints on the ligature did not match any known individuals in law enforcement databases. The chain of custody was meticulously documented throughout evidence collection and transport to forensic laboratories for further analysis. Upon examination of the deceased's neck region, multiple ligature marks consistent with strangulation were noted. Forensic pathologists utilized high-resolution imaging techniques to document the presence and characteristics of these marks, including coloration and width. Microscopic analysis was conducted on tissue samples extracted from the affected areas, employing hematoxylin and eosin staining for histological evaluation. This revealed marked subcutaneous hemorrhage and ischemic changes indicative of tracheal compression. Additionally, immunohistochemistry panels were run to detect markers of vascular injury and inflammation. The findings confirmed a pattern consistent with acute mechanical asphyxia resulting from external pressure on the neck structures. Specific measurements indicated a ligature width of approximately 2 centimeters, correlating with observed hemorrhagic patterns in the underlying tissues. The examination of ligature marks on the neck indicated a single instance of tracheal compression, consistent with mechanical asphyxia. Photographic documentation and macroscopic analysis revealed distinct patterns suggesting the application of moderate to severe pressure over an extended period, approximately 5 minutes, based on the depth and distribution of hemorrhagic discoloration around the larynx. The examination of ligature marks on the neck indicated a single instance of tracheal compression, consistent with mechanical asphyxia. Radiological imaging confirmed no foreign body entrapment or fracture, ruling out other causes of death such as hanging or choking. Postmortem interval was estimated between 12-24 hours post-death, consistent with decomposition stages observed in the livor mortis and rigor progression. This timeline corroborates witness statements indicating a prolonged struggle before the cessation of vital signs. The sequence of events established by forensic evidence confirms the cause of death as ligature-induced tracheal compression and rules out spontaneous or accidental causes, aligning with the absence of defensive injuries and presence of consistent mechanical trauma patterns. This timeline corroborates witness statements indicating a prolonged struggle before the cessation of vital signs. Upon examination of the deceased, tracheal compression marks were identified indicative of manual strangulation. Ligature marks consistent with a cord or strap-like material were also noted on the neck. The presence and nature of these marks suggest both manual pressure and external restraint mechanisms were employed during the incident. Tracheal hemorrhage and petechiae confirmed severe hypoxia, supporting asphyxial death due to mechanical airway obstruction. Expert testimony would affirm that the observed injuries are consistent with a sustained strangulation event involving multiple modes of application. The expert would testify under oath regarding the specificity of these findings, asserting their relevance in establishing both the manner and mechanism of death. Conclusive evidence includes direct injury patterns. Interpretive analysis involves reconstructing the sequence and duration of applied force. Chapter Resolution upon thorough examination of the deceased's neck region, a critical ligature mark was identified, consistent with manual strangulation. Initial external inspection noted petechiae and congestion of conjunctival blood vessels, indicative of asphyxia. However, it was not until microscopic analysis that tracheal compression marks were definitively established. These findings corroborated the presence of a restrictive force applied to the neck, leading to occlusion of the airway. The pattern and distribution of these marks indicated their origin from a ligature consistent with a thin cord or wire. Forensic photography and macroscopic imaging confirmed the precise nature of the injuries, ruling out accidental causes such as positional asphyxia. The central finding shifted the investigation's focus towards homicidal intent rather than an accidental death or suicide, due to the deliberate application of force. The final determination was based on the presence of both external ligature marks and internal tracheal compression evidence, providing unequivocal proof of strangulation as the cause of death. This case underscores the critical importance of detailed ligature mark analysis in establishing the mechanism and manner of death due to strangulation. Tracheal compression marks provide definitive evidence, guiding forensic pathologists towards accurate conclusions. The file remains open.